Welcome everybody to MoRat Nation. I'm Bob Carmichael and let's get started. To begin with, I should mention that I am not a doctor and that these are my personal views and are not intended as medical advice. This is a serious warning for anyone using metformin for life extension. I recently made a video where I talked about metformin. Here is a short clip from that video. Metformin is the most prescribed drug for type 2 diabetes. Metformin works by increasing insulin sensitivity and lowering blood sugar levels. Metformin is able to do this by lowering the absorption of glucose in the intestine, decreasing the production of glucose in the liver, raising the amount of glucose absorption in muscle. So why is metformin such a focus of interest by the anti-aging community? When metformin lowers glucose in the liver, it activates the AMPK pathway. This pathway is thought to be the reason insulin sensitivity is improved and why people on metformin have a decreased risk of cancer. But the big reason everyone is so interested in metformin is its effect on Mtor. Mtor is the target of another big anti-aging drug, rapamycin, which I will cover in part 2. But for now, it's enough to know that you must inhibit this nutrient-sensing pathway if you want to live a long life. Metformin is the focus of several large clinical trials. The best known is the Tame trial, led by Nir Barzilai. This is the first trial to recognize aging as a disease. Metformin has the nasty effect of depleting B vitamins, and I turn out to be low on thiamine, or vitamin B1. I don't know this for a fact, but most people with a thiamine deficiency, such as alcoholics or patients with essential tremor or Parkinson's disease, will have a hard time taking metformin. After making that video, I began to think about whether or not I should take berberine. It sure showed some remarkable results when compared to metformin. Recently, I have seen some alarming studies where mice bred to develop Alzheimer's disease showed a rapid acceleration of amyloid plaques when Mtor is blocked. It's now starting to look like that without Mtor activation, these amyloid plaques are not cleared because the Trem2 gene is not upregulated. And the most troubling part is that when you take metformin at night, as a lot of people do, you block the time when Trem2 gene is most active. Wow, this sure brings up a lot of questions, such as, should trials involving metformin continue? Should people with a genetic propensity for Alzheimer's disease or dementia still continue to take metformin? I am APOE3 and I have no one in my family with Alzheimer's disease. My mother did not have Alzheimer's, but she had cognitive impairment, but that was from a series of small strokes. I have trouble taking metformin, but I do try to take berberine. Does this have the same effect as blocking or inhibiting Mtor? Could drugs that have such an indirect effect on Mtor, such as metformin, accelerate Alzheimer's disease or cognitive decline? And much more to the point, what effect will this have on the very important Tame trial run by Nir Barzilai? This critical trial is designed to demonstrate to the FDA that drugs like metformin can be prescribed for conditions related to aging and not just for specific diseases like diabetes. Did they screen for people with Alzheimer's risk or cognitive decline? It would be a tragedy if all the work that has been done in the Tame trial, if this new information ruins the outcome. So what have I decided? This new information has convinced me to wait until we have further information about the long-term effects of metformin and berberine. I'm sure that now researchers know there could be a problem caused by Mtor inhibition. They will find a way around this problem. I'm sure they are already working on a Trem2 gene activator that could be taken with rapamycin to eliminate the problem. But we won't know that for at least another year. I plan on making several other videos about this subject, so please click on the playlist at the end of this video and subscribe to Mole Rat Nation. I have no financial ties with any of the products mentioned in this video, and thanks for watching.